Before we begin, I want to note that these physicians are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employer. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves, and please do not include any employment information or other affiliations unless they expressly share those. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Barr.
Hello, thank you for having me here today, and thank you for joining us. I am Dr. Laurel Barr, and I am a practicing emergency physician in the Columbus, Ohio, and surrounding areas. And I am here on 3 hours of sleep because I would like to protect my patients before they become my patients. As an emergency physician, every single day, I see what happens when people cannot get the health care that they need, when a routine medical problem becomes a crisis. The emergency department is our society's safety net, but due to the consequences of failed health policy, it's full of holes, and we're drowning. Many blood pressure medications cost less than $20 a month, but without health insurance to pay for medications or a regular doctor to prescribe them, and with the rising prices of food and gas, many patients go without these life-saving medications. When, not if, they have the heart attack that could have easily been prevented, I see them, I stabilize them, and I admit them. And I give them their blood pressure medication. And they still can't afford it. This just doesn't just cost them their health, it costs society substantially more. Thousands of dollars for hospitalizations rather than a few hundred for a year of medications. Sometimes it's through higher costs for public insurance. Sometimes it's a cost absorbed by the hospital when no one pays for their care. I will never look at you or anyone else who is having an emergency and turn you away. It takes many highly trained doctors, nurses, and other healthcare professionals to deliver this complicated life-saving care. These and other preventable emergencies are happening in uninsured patients so often that many rural hospitals in the state are in danger of closing. When rural hospitals close, everyone loses. Rural residents travel further for care, city hospitals are more crowded, and residents wait longer. A diabetic who couldn't afford their insulin, a father who put off seeing the doctor because they lost insurance, a parent whose child got sicker before they had anywhere else to turn. By the time many people reach us, a problem that could have been treated earlier has become far more serious and far more expensive. This experience is why I'm deeply concerned about what a Vivek Ramaswamy governorship could mean for Ohioans' health. Ramaswamy called Medicaid a mistake, and during his failed presidential campaign, Ramaswamy criticized Donald Trump for failing to repeal the Affordable Care Act. More than 469,000 Ohioans rely on the Affordable Care Act for health coverage. 10 rural hospitals in Ohio are in danger of closing due to the Affordable Care Act cuts. For these hundreds of thousands of our neighbors, the Affordable Care Act is not a political talking point. It's a lifeline. It's how they afford a doctor's appointment, a prescription, or a treatment for an illness before it becomes serious. I wish every politician who defunds the Affordable Care Act or Medicaid could spend a shift in the emergency department. I wish they could look my patients in the eye, like I do, and tell them they can't get them their medications. I have to do that every day, and I'm sick of it. I can't fund healthcare, but politicians can. It's their job. Medicaid is the insurance card that allows a working parent to take their child to the doctor. It's access to medications that keep chronic diseases under control. It's prenatal care, mental health care, nursing home care. It's care at your local hospital where you need it, when you need it. Treatment that keeps people healthy enough to stay out of the emergency room. When people who lose healthcare coverage, they don't just disappear and they don't stop getting sick. They simply lose the ability to get care when and where they need it before it's an emergency. Ohio needs a governor who understands what healthcare access means to real people. We need leadership that helps patients get care before their condition becomes an emergency, not politicians who use healthcare as a bargaining chip. If Vivek Ramaswamy brings his priorities to the governor's office, Ohio patients will pay the price. Now I'd like to introduce Dr. Griffith to speak.
Thank you, Dr. Barr. I'm Tracy Griffith. I'm an OBGYN practicing in the Cleveland area. As an OBGYN, it's my job to care for patients at some of the most vulnerable moments of their lives when they're pregnant, when something goes wrong with a pregnancy, when they face difficult and deeply personal decisions about their health, their fertility, and their future. These decisions should be guided by patients, their families, and their trusted medical team, not by politicians. That's why Vivek Ramaswamy's record on reproductive health should concern every Ohioan. Ramaswamy has described himself as unapologetically pro life. Ramaswamy called abortion murder. And he said that the Supreme Court was correct to overturn Roe versus Wade, which gave women the right to choose. He has said he was willing to consider a federal abortion ban and has expressed support for a 6-week abortion ban at the state level. Florida has a 6-week abortion ban in place, and he called this reasonable, despite the fact that many patients don't even know they are pregnant by 6 weeks, and it's impossible to do genetic testing for the health of the pregnancy that early. In 2023, Ohio voters made their voices heard by approving a constitutional amendment protecting abortion rights. Ramaswamy said he was upset. That should tell Ohioans something important. He was not just on the wrong side of Ohio voters, he was upset that Ohioans exercise their right to protect their own reproductive freedom. His extremism goes even further. Ramaswamy said the Supreme Court should overturn the FDA's approval of mifepristone. This is a medication used not only for abortion care, but for miscarriages and stillbirths. Mifepristone is safe and effective and has had FDA approval for over 20 years. Finally, Ramaswamy has even called for defunding Planned Parenthood, which are integral parts of communities and where many people get basic health care, contraception, cancer screenings at minimal or no cost. Vivek Ramaswamy is too extreme for Ohio. In our state, we trust women to make their own healthcare decisions. We believe personal medical decisions belong between patients, their families, and their healthcare team, and politicians should stay out of exam rooms. Yet Vivek Ramaswamy has repeatedly demonstrated that he believes politicians should have extraordinary power over these profoundly personal decisions. For my patients, healthcare is interconnected. Losing insurance can mean losing access to preventative care, contraception, prenatal care, cancer screenings, and treatments when complications arise. I've treated many patients in my practice that had a cancer that could have been caught sooner had they had insurance. Ohio has already made clear that it values reproductive freedom. We should not hand the governor's office to someone who is upset by that decision and has built a record of trying to move Ohio in the opposite direction. Our patients deserve better. Ohio deserves better. I would now like to introduce Dr. King to speak.
Good afternoon. I apologize. I feel like I'm coming down with something as well. So my name is Dr. Nicole King. I'm an anesthesiologist and an ICU physician who practices in the Cincinnati area. I care for some of the sickest patients in the hospital. People whose lives can change in an instant, and families facing some of the most frightening moments they will ever experience. In the intensive care unit, there's no room for ideology. There's no room for wishful thinking. We deal in reality. What does the patient need? What treatment will give them the best chance for a meaningful recovery? How do we make sure we are honoring our patients' wishes during their hardest moments? Vivek Ramaswamy clearly doesn't have any idea what my job is like. From wanting to come between patients and their doctors when it comes to reproductive health care, calling Medicaid a mistake, to calling out Donald Trump for not repealing the Affordable Care Act, it's clear that Vivek Ramaswamy doesn't value healthcare. That was apparent, however, even before he started running to be a politician. Recent reporting details how he tried to sell a failed drug for Alzheimer's, putting his brother and mother on the company payroll and manipulating trial data to make the drug look better than it was. He made billions, all while promoting the already failed drug as a possible breakthrough for those with Alzheimer's. We all know someone affected by Alzheimer's and other forms of dementia. It's tragic. To peddle a drug that's been shown to be ineffective only to make money is wrong. So it's no surprise that Ramaswamy is now using healthcare as a political weapon to try to win public office. The healthcare shouldn't be weaponized for political purposes. Medicaid is a lifeline for millions of Americans, including Ohioans with disabilities, seniors, children, and working families. Calling it a mistake while supporting policies that strip coverage away from hundreds of thousands of people is wrong. Ohio hospitals and physicians are already being asked to do more with less. Policies that increase the number of uninsured patients don't make healthcare cheaper or more efficient. They shift costs, strain hospitals, and make it harder to provide care for everyone. Ohio needs leadership grounded in protecting patients and strengthening access to care. Vivek Ramaswamy's record points in the opposite direction, cutting Medicaid, threatening ACA coverage, and putting ideology and political extremism ahead of the needs of Ohio patients. That is a risk Ohioans cannot afford to take. Thank you.
Thank you so much, Dr. King, Dr. Griffith, and Dr. Barr. We'll now open it up for questions. If you have a question for one, any, all of the physicians, you are welcome to raise your hand and I can allow you to unmute to ask your question, or you can type your question in the chat or the Q&A function and I can help read that for the physicians. So we'll allow a moment for folks to be able to raise their hand or type their questions. I had one chatted just to me. I will share with you all. Ramaswamy has also supported cutting SNAP benefits from Ohio families. Have you seen patients impacted by SNAP cuts? What happens when patients lose access to reliable food? I think that's for any of you.
I think this really applies to my practice where I take care of patients that are pregnant. A lot of people, struggle to provide for the families that they already have. But when you're pregnant and you need to support good nutrition, affordable food becomes very important. So I have patients that maybe can't afford food or are choosing whether they can afford food or medication, or whether they can afford food or rent, or whether they can afford food or driving to the doctor's office, or whether they can afford food or paying for a lab test or an imaging study that we recommend, or maybe paying for food for themselves or a child that they already have. So it's pretty devastating.
I can tell you, I also see patients every day that make this decision, and it's heartbreaking.
Yes, I agree. Though less likely in my anesthesia job in the ICU, I too see the end results of people choosing or being forced to choose between medication and feeding themselves and their families, and sometimes with catastrophic complications.
And the other aspect to that is when they lose money for food, they try cheaper options, which tend to be highly processed food, which increases their risk of chronic diseases such as diabetes, hypertension, heart attacks, strokes in the future. And we can see that, but you have to get what you can afford and you have to get something.
Absolutely. Thank you all, and thanks for that question. I had another question chatted to me. I will share. Excuse me. As you mentioned, Ramaswamy made millions of dollars from an Alzheimer's drug that didn't even work. Would you say this is part of a growing pattern of billionaires using people's healthcare to profit? If so, what do you think can be done about it? And that's for any of you. I can repeat it. As you mentioned, Ramaswamy made millions of dollars from an Alzheimer's drug that didn't even work. Would you say this is part of a growing pattern of billionaires using people's healthcare to profit? If so, what do you think can be done about it?
I think what can be done about it is a more complicated question, because at the end of the day, they need to be held accountable for that. So I think it's up to lawmakers to hold them accountable. I definitely think that there's a growing trend of healthcare for profit. We've seen that with the insurance industry. And I think insulin is a great example. The scientist that developed insulin sold the patent for $1 because he wanted patients to be able to get it and to help people. And now people can't afford it because companies want to make money off of it.
I can say that the influence of private equity in emergency medicine is changing the landscape and taking control away from the doctor and the patient at bedside, and putting it in the hands of those who are farther removed from the people they are serving. And I think that it is evident in the decisions across healthcare systems nationwide and in the way that healthcare is being funded. And I think that there's not an easy solution, but that putting healthcare decisions in affordability and accessibility back in the hands of the doctors and the patients and their families and those around them and allowing to access healthcare would drastically decrease the cost of healthcare across the board by preventing a lot of these major medical issues due to chronic illnesses.
Thank you both. We'll allow another moment or so if there are any follow-up questions. In the meantime, I'll also say we have been recording this. So if you'd like a copy of the recording, please send me a chat right now, or you can send me an email where you RSVP'd, and I can get that over to you early this afternoon. Okay, so one more question come in. Putting it in the chat. Ramaswamy has spent hundreds of thousands of dollars on private jet trips in recent months. Do you think he's out of touch with the healthcare affordability crisis Ohioans face? Again, that's for any of you. Ramaswamy has spent hundreds of thousands of dollars on private jet trips in recent months. Do you think he's out of touch with the healthcare affordability crisis Ohioans face?
I mean, I think I would say that's absolutely true. And I think kind of circling back to the prior question, I actually think billionaires and other people looking to take advantage of a situation are choosing to kind of exploit the doctor-patient relationship and some of the breakdown in that, with the breakdown in communication and the lack of transparency. And instead of trying to work on that and do what we can for both the healthcare provider and the patient, instead we're actually exploiting that in order for other people to make money off of the lack of trust in the system. And I think that that is exactly what's happening here. Understanding that these same people who are exploiting it or out of touch with it have access to the best care in the world and can pay for it in cash, which is something that even people who have good insurance and or have higher paying jobs with good coverage still can't pay for any of this in cash. And that's what separates those people who are completely out of touch with those of us who are actually in the system.
I think that's a really good point, Dr. King. And I had a really good example of this of a patient that I saw in my office. I deliver at a level 1 hospital, so it's pretty low risk pregnancies and deliveries. I had a patient that had a complication. I recommended she go to a hospital about 30 minutes away. And they said, well, we don't get paid till next week. We can't drive there. So she had to just go to the closest hospital that she could afford to drive through and go by ambulance to go to my other system just to get the care she needed. And I think it's really hard for someone that's flying by private jet to relate to that and to understand what my patient's needs are and what her concerns are.
I can't really comment to Mr. Ramaswamy's mental mind state, but I can tell you that I routinely hear from my patients that they can't afford food, they can't afford their medications. They're choosing between taking their blood pressure medications and getting their children what they need. I have never heard a patient complain about the experience on their private jet.
Thank you all. There's another question in the chat. Ramaswamy's opponent, Democratic candidate Amy Acton, has discussed eliminating some medical debt statewide. Can you speak to whether this is possible and how it could impact Ohio's healthcare landscape? Again, Ramaswamy's opponent, Democratic candidate Amy Acton, has discussed eliminating some medical debt statewide. Can you speak to whether this is possible and how it would impact Ohio's healthcare landscape?
So I think anything is possible. It just takes the political will to do it. It may be complicated, but if we want it and we talk to our politicians and they speak to us and we know what we want, I think we can get anything we want. It may take time and it may be very hard. I can tell you that I have been practicing as an emergency physician for more than 10 years. And when I was training, medical debt affecting patients long-term was not a thing. It was seen as something that would be bad politically for the institutions that provide care. Fast forward 10, 15 years later, and it's the number one cause of debt on an American's credit report. And it's not their fault. It's not really telling you anything about whether or not they're responsible if they have a medical emergency and their insurance didn't cover thousands and thousands of dollars of it. And these are people who need care. These aren't people who are just coming to the emergency department for nothing. They're coming to the emergency department and getting admitted for life-saving care. And it's becoming more and more of a problem that did not exist when I was training. And now, especially when I work at outside hospitals, when patients need transferred for higher levels of care, they're concerned about their ambulance bills. And I've had people with heart attacks who tell me they can't afford an ambulance. They got a $5,000 bill the last time, they can't afford it, and they want to go in their car. And I have to discuss the risks and benefits of this because I don't want them to lose their house. I don't want them to not be able to pay their bills because a 30-minute car ride or an hour car ride, they could decompensate and trip. And it's just another risk and benefit that I have to discuss with patients that never used to be a thing.
Thank you for sharing that. It's such a horrible growing issue, and thank you for that question, Paige. I'm
I
not
think
certain.
I think one of the things that people don't realize also, even when they assume that we have these safety nets in place, if you can call them that, we also forget that even when people have decent insurance coverage, when they have a catastrophic life event, to include a heart attack or cardiac arrest or a massive stroke that needs long-term care, no matter how much insurance you have in the current setting, with how the cost of care from the ER all the way through into rehab, most patients can't afford that even with insurance. And I have seen, it is not a lot, but I have seen patients choosing and patients' families choosing not to continue with heroic measures to save their family's life because they would actually be forced to spend down everything that their family owns or has ever earned in order to qualify for Medicaid coverage, in order to provide the appropriate care to their family member. And these are decisions that I never thought I would see people making, and it's happening on a relatively regular basis now, in a way that I never thought possible.
I think it's also worth noting that the leading cause of medical debt is actually patients with private insurance. It's not actually the patients who are uninsured or with Medicare or Medicaid. And as the system goes forwards, insurance companies continually post profit and increase their profit. Doctors, hospitals, physicians' offices are at risk of closure. And patients are stuck in between, and they're footing these large, large bills. And it's not patients who are irresponsible. It's patients who have jobs, who have private insurance. And that insurance is just increasingly leaving a gap that they can't provide for.
I think that was such a good link, Dr. Barr, and I'm glad you brought that up because I think ultimately what this comes down to is access. We can eliminate patients' medical debt, and that money isn't necessarily being drained because hospital systems can't absorb this either. And that's why we've seen, I know it's been a problem in rural emergency rooms, and it's a huge problem in obstetrics. There's over 11 counties in Ohio that don't have an OBGYN at all. And I think, the more debt that's in the system, the more hospital systems that close and the harder it is to get that care. And then the rest of the system has to absorb that somewhere.
And I think eliminating medical debt is helpful, but we need to all work together to improve the system so that these shortfalls don't exist. And I think that's why we're here today.
Absolutely. I think that's a great note to end on, as I'm not seeing any other questions. Again, if you would like a copy of the recording, please let me know. But thank you so much, Dr. Barr, Dr. Griffith, and Dr. King for your time today, for shining a light on these issues with the healthcare system and how a Ramaswamy governorship could make it worse. We hope that you'll continue your advocacy to make the healthcare system better. And thank you for everything you've done already for patients and for all Ohioans. And thanks to everyone from the media who joined today. We appreciate you being here and lifting up these issues.
Thank you.
Thank you all and have a good afternoon.
Thank you, everyone.